Hello everyone, and thank you for checking out this video. My name is Matt Buffano, and chances are, if you're familiar with my work at the Citizen's Voice, you know me as a sports writer. But we are all pitching in on the news side of things right now, and my latest news article is about what you'll see in this video. That is an interview with Martin Novak, an author from Virginia, whose ancestors hail from northeastern Pennsylvania. And Martin wrote this book, Spanish Influenza in the Wyoming Valley, The Human Cost of the 1918 Influenza Pandemic. This book published late last year after Martin worked on it for 3 years. And he never envisioned that it was going to be, unfortunately, so topical in the year 2020. It was a healthcare crisis back then. It's a healthcare crisis again today. Bars, clubs, schools, churches, everything was shut down back then, and it's shut down again today. And a little bit of background on the Spanish influenza. Remember, this is a disease that killed millions of people. We're talking 20 to 50 million people, including several 100,000 in the United States. Wilkes-barre got hit hard. Northeastern Pennsylvania got hit hard. Philadelphia got hit really hard. This was also a time where America was fighting World War I. And then, boom, we're fighting a virus, too. A virus that was particularly fatal for people ages 18 to 40. This book, interesting stuff, 191 pages. It's available on ebook for instant download, $6 on Amazon, or you could order the paperback version, which will take a little bit longer to get there, and it's a couple more bucks. Again, it's unfortunate that this is such a relevant topic in the year 2020, but it was a good discussion here with Martin. The interview, the audio in the first minute's a little bit choppy, but don't worry, it picks up, and I think you'll find some interesting stuff in here. And again, trying to find inventive ways to tell stories, and we'll give this a shot. So I hope you enjoy the interview, and thank you for reading, thank you for viewing. Martin, first off, thanks for taking the time to do this, and let's just start with getting to know you a little bit. You have some Wyoming Valley roots, which you wrote about, and that sort of inspired you to write this book with a local slant. Could you just elaborate on where the idea stemmed from?
The idea sort of stemmed from some genealogical research that I've been doing on actually my father's side of the family, and I ran into a family that, although they weren't directly related, their story caught my attention, and I even write about it in the book. It's Michael and Anna Shimura, who had been recent immigrants from Poland, and who both died during the second lethal wave of influenza between October and December of 1918. And what particularly caught my attention, being a genealogist, a lover of his history, is the fact that there were scant little records of these people that existed. I could find no records of them in U.S. Census, although I believe Michael was here by 1910, so maybe he was in one somewhere. But there were no records of them, and they left 3 orphans. And I wondered how many other families did this happen to. So I was really kind of curious about the human cost, the social aspects of it all. How did it affect people in their daily lives and how they lived, if they lived?
Right, and also you mentioned, since this was over 100 years ago, you mentioned in the book that there were no first-person accounts that you could go to, just mostly newspaper reports and libraries, I'm guessing. Like, what sort of resources did you use to research this story?
So, fortunately, there exists a great archive of newspapers from the Wyoming Valley, from the Scranton newspapers, Wilkes-barre newspapers, the Pittston Gazette, and others from throughout the Wyoming Valley, and sometimes to put together, a single story of a person, it took several articles from different newspapers. Sometimes I was able to find the death certificate for some of them, and it was just sort of taking all the information and welding it into a story more than anything.
Okay, and how would you describe the toll that the Spanish influenza took on the Wyoming Valley versus other parts of America?
I believe it was devastating for the Wyoming Valley, and the statistics bear it out that Pennsylvania was one of the hardest hit states in the country. Part of that was probably due to the heavy manufacturing in Pennsylvania and the coal mining. So there was coal mining, there was ironworks, there was cigar making factories, there were silk making factories, dress factories, all places where people were within close quarters of one another, which afforded the influenza virus ample opportunity to find new victims.
Okay, and now with the coronavirus, we see all these social distancing measures and things along those lines. Were there any mitigation measures put in place to kind of halt or slow down the Spanish influenza?
I think from the research that I did, most of the quote-unquote social distancing at the time was done at the local level. You know, a town or a city would close bars, forbid public funerals. You couldn't go to church, but there certainly wasn't a nationwide response at the federal level, because one has to remember is that we were in the midst of being involved in World War I. And the last thing anybody wanted was word of an epidemic spreading around and causing people to panic and, you know, losing any momentum that we had in supporting the effort to win World War I.
Okay, and how did the Spanish influenza reshape the Wyoming Valley, according to your research?
Well, I mean, I would say it's probably made people appreciate the lives that they had more. Those that survived it, those that got the influenza and managed to survive. It certainly took away quite a bit of a generation, because the age group that it affected most was those between 18 and 35, which was the prime years of your life. So there were probably fewer marriages, fewer children. I just think overall it probably gave people time to reflect and understand what's most important in life. Kind of sort of as we are now.
Yeah, true. And when the COVID-19 started hitting America, when it started appearing in the headlines, did you ever have a light bulb go off in your head like, we've seen something somewhat similar to this, albeit 100 years ago?
Yeah, I actually think the similarities are quite striking, really, because at the time, during the Spanish influenza, there was a general inclination not to deny, but not to acknowledge that there was a pandemic at hand. They had the war bond rallies, so you had a lot of people gathering in very close quarters. I guess Philadelphia was sort of the prime example of that, when the health director for the city of Philadelphia even said, please don't have this meeting. We cannot have people in close quarters like this. They went ahead with the meeting anyway, and the very next week they had an incredibly high number of not only instances of Spanish influenza, but an incredibly high number of deaths as well. And then, when I saw this coronavirus first starting, one of the things I thought about when I was reading the book was that Spanish influenza spread throughout the world, and they didn't have airline flights. They didn't have instantaneous travel like we have today. So the possibility of something like this spreading, I think, is even more pronounced today than it would have been 100 years ago.
Okay, and I'm skimming through the book. I've been reading through it since I purchased it this morning on Amazon. Is there any anecdote in there that you found particularly striking? Anything that, when you were researching it, you said, man, I got to include this in the book?
It was just, it was just all the stories about people kind of living their lives and sort of, because it was the 18 to 35 that had the highest number of deaths in the Spanish influenza. A lot of those stories I found very interesting because here were people in the prime of their lives getting ready to live their lives, and their lives were cut short. One thing that I hadn't really thought about including in when I first started writing the book was the chapter "Death Everywhere."
Mm-hmm.
But I really wanted to impress upon the reader that this was, although the Wyoming Valley certainly suffered in kind, they were certainly not alone in their suffering. The image of the funeral pyre in Tahiti was one that kind of stuck in my mind because they didn't have enough people to bury the dead. They ended up having to burn bodies instead, and that seemed to happen in quite a few places actually. The little outpost of Okak in northern Labrador that had existed since 1776 was essentially wiped out. They were a native peoples of that part of Labrador, and they didn't have any way to fight off the disease, and they were essentially wiped out. Of the 263 Inuit Eskimos that lived there, 204 were dead by the end of the influenza. Those kind of numbers to me were just astounding, and I kept finding statistics like that, just incredible numbers of people being affected by this. And then there was one other one that I saw, Michael Pilato, who's sort of near the end of the book, and as it turns out, he's related to me. He's like a third grade uncle or something like that, who killed himself thinking that his wife had died from influenza, or somebody gave him bad information. Turns out that she was gravely ill, but in fact she survived. And it was just, it was stories like that that really caught my attention, pulled at the heartstrings, as it were. Because I think it's all too easy to get lost in the statistics of number of people that die, or number of new cases per day. But behind each and every one of those cases, and behind each one of those deaths is a person, a life, a mother, a father, a brother, a sister, an uncle. And even though you or I may not know them, someone certainly did.
Sure. And it seems like December 1918, it seems like that's where the tide started turning a little bit. Is that a fair representation?
Yeah, I think officially it went on until sometime in January, maybe even late February of 1919. But for the Wyoming Valley, the Spanish influenza really seemed to have petered out by the end of December. In fact, that's when they were able to open schools again, have life return to somewhat normal, at least as they understood it.
And the schools, as you mentioned, you wrote here that schools had been closed since October 7th and then reopened December 4th, so a total of 58 days, which I think in the Wyoming Valley today with coronavirus, we're going to see probably much longer than that.
Probably, yeah.
All right. And in terms of the effects that the Spanish influenza had physically, the toll that it took on people, are there similarities there with the coronavirus? Like the coronavirus, a lot of people are saying it's the respiratory system that shuts down.
Well, I think the thing that I don't want to say impressed, but that's I guess horrified is the right word. The Spanish influenza seemed to have affected people almost immediately when they caught it. Like they would feel ill one evening, and then by the next afternoon they were dead. and this thing had an incredible lethality to it. So this is probably the first thing that we have seen that's worldwide that is this lethal, this quickly, and affects this many people.
Did you find any sources of hope or inspiration in the Wyoming Valley's response to the Spanish influenza? Like here I'm reading, quote, the people of Scranton responded to a plea for help, donating toys, clothing, food, baby clothes, pajamas, and cash. Did you find that people came together in a way?
Yeah, in particular as related to the many orphans that were left behind. Because you got to remember, a lot of young parents, both the mother and father perished from Spanish influenza, leaving their kids behind. And it seemed like the Wyoming Valley and Scranton, Wilkes-Barre, and the towns and boroughs in between, they really kind of came together and supported charitable efforts for the orphans and the widows. And I believe there was in Scranton, be a Santa Claus to somebody who needs it, and they would publish their stories about the orphans that aren't going to have a Christmas unless they get help, and the people in droves and a number turned out to help and provided monetary support, even though probably they didn't have very much money or resources themselves. They still understood that there were people that were worse off than them.
True. And I think what you were talking about there was the Order of Santa Claus, which you wrote here.
Claus, that's it.
Yeah, it was the brainchild of the city's newspaper, the Scranton Republican, and the paper ran articles daily seeking members and relating stories concerning neediest members of the community. You also wrote that the Salvation Army and the Red Cross were there, and the Elks, Associated Charities Jewish Federation, United Charities of Pittston, Scranton Catholic Diocese, a lot of organizations were in this together.
Right. And I think another, stark difference to me is the fact that in 1918 there was no Center for Disease Control. A lot of the mechanisms that we have about getting out information, a lot of the science things that we understand much more fully about how viruses affect people, the methods that we need to employ to curtail them are much more understood today than they were then. But just like then, when they did not have a vaccine, we also don't have a vaccine for this particular one.
Before we wrap up the audio portion of this interview, where could people buy this book, and what would be your pitch to what they're going to get in there?
They can get it on Amazon.com, and I would say if you want something more than what Spanish influenza was like medically or scientifically or biologically, this is the book for you, because it really talks about people, how the influenza affected people, and how they went about their daily lives and how it affected them.